Hi, this is David Gilpin, Dr. Gilpin here. We're here with Chelsea, and we're talking about injecting lips today. And we're also going to do a live injection of Chelsea's lips so you can see how this works. So Chelsea, let me grab the microphone here. Tell me, what are your goals today for your lips?
Just to get a little bit more volume.
Okay, maybe help roll them out a little bit, give you a better lipstick line, yes?
Yes.
Okay. Tell me, do you wish to have, I know we can see on TV some pretty, some folks talk about they want duck lips, things like that. Is this something that you're looking for today?
No, I just want some natural fuller lips.
Natural fuller lips. Okay, that's wonderful. So that's one of the common misconceptions, that if you have lip filler, that you're going to look strange or different, and that's really not the goal here in our office. So what we're going to do is right now we're going to go ahead and get started. Chelsea already has some numbing cream on that's been sitting on for about a half an hour, so she's pretty numb right now. So we'll go ahead and get started with that. What we're using today is what we call a hyaluronic acid filler. There are several different ones that you can use to get fuller lips. Today we'll be using Restylane. All right, we'll go ahead and get started. Again, Chelsea's already been prepared. She's pretty numb. So taking a look at Chelsea's lips, I think probably starting over here would probably be the best option because she has just a little bit of little more deficiency on this side. So Chelsea, just kind of open up for me just a little bit. I'm just going to test you here, okay? Feeling anything sharp there?
Nope.
Okay, wonderful. So we're just going to place a little injection. I'm just going to feel my needle there. I'll get my hand out of the way in just a second so you can see what I'm doing. We're just slowly injecting here and giving Chelsea just a little more volume. I'll take that and I'll just kind of massage that in, make sure we don't have any lumps or bumps in there. Perfect. Close for me, Chelsea. Good. Perfect. Open for me. Wonderful. Let's pull a bit right there. What this will do is it's just going to give her a little bit more fullness. Close for me. Good. Perfect. And we're already seeing that. Open for me. So it's a lot of opening and closing here. That's just fine. Not a lot of bleeding here, especially if you let that numbing cream sit for some time. There we go. Close for me. Perfect. And open for me. Good. A little bit of oozing there, but not much. Perfect. Close for me. There we go, and this I think is a really good, kind of a good time to kind of compare one side versus the other. Open for me there, Chelsea. Let's put a little bit more right here. Perfect. Beautiful. Let's go ahead and we're just gonna close for me. So we're just gonna kind of balance out this lower lip. Open for me. So really the goal here is to make the lower lip balance the upper. A little poke here, Chelsea. 1, 2, 3. Poke. Doing okay?
Mm-hmm.
All right. So I'm just asking Chelsea how she's doing. Make sure that she's not feeling anything, and she's not. She's tolerating this very well. Again, she's had some close for me, some numbing cream. So there's a really good shot right there of one side that we filled, the other side we haven't. Again, Open for me. It's not a, we're just going for some fullness here. We don't want her to look, anyway, strange or unnatural. Beautiful. Close for me there, Chelsea. She's got some very nice correction on that side. I'm going to switch out my needle here. We'll move to the other side, and that'll be it. So we usually will have some asymmetries. One side will be a little more deficient than the other, and that's okay. That's just kind of the way we're made. Beautiful. Open for me there, Chelsea. Perfect. So we're going to kind of go here. I'll try to stay out of the way so you can see what I'm doing. A little poke there. Doing okay?
Mm-hmm.
All right. Then I'm just kind of supporting her lip there with my fingers. Make sure I know exactly where this product is going. Doing great. Okay, we're just balancing one side with the other. Close for me. Perfect. Open for me. Got a little dip right there, so we'll fill that in. Not a lot of oozing or bleeding or anything like that, especially if you're taking your Arnica Montana. We make sure that you're not on any sort of blood thinning medications. Perfect. Close for me. Perfect. You know what to do. Open for me. Let's put a little bit more there too. Looks wonderful. After this, we're going to ask Chelsea to really ice quite a bit. Perfect. So again, we can kind of see how we're getting this nice fullness just and really kind of bringing it out from the side view, from the lateral view. Open for me there, Chelsea. Good. Let's balance out this lower lip here. So a lot of folks say, well, I don't know if I need my lower lip done. Well, what we do is we'll get the top lip started. Close for me. Open for me, and we balance out that lower lip. But Chelsea's done all the right things, staying off of her blood thinners, taking her Arnica, so she really has just minimal oozing. Let's give it just a little more volume, and then I think we'll be done. Am I bothering you, Chelsea?
No.
Perfect. So as you can see with this, we also hear a lot, you know, I'm afraid of the pain that this is going to cause, and really this is not does not have to be a painful procedure at all. Close for me. Good. Let's put just a little bit more over here. Just kind of work ourselves back and forth until we're perfect. Close. Make sure we're nice and symmetric. Open for me, and we are. We're going to ask Chelsea to really ice quite a bit after this. Just ice, ice, ice. Really help the swelling a lot. She doesn't have any nodules or anything like that I feel. Close. Perfect. Open for me, Chelsea. Perfect. Put just a little bit right here in the center. Sometimes you need some right in the center. And the lower lip. Balance that out. Ooh, got a little bleed there. That's all right. We'll hold a little pressure. And we'll go over here. Put just a little bit more over there, and I think we're going to be good. Hold a little pressure right there. There we go. Perfect. Close. I like those a lot. They're very nice, very natural. Give her some wonderful definition there. And I think that's very good. How was that there, Chelsea?
It was good.
It was okay?
Didn't feel a thing.
Didn't feel a thing? Okay. So I'm just going to check and make sure I don't feel any nodules. Sometimes, we can feel those, and we just kind of massage those out. I don't. I think you're going to do just fine. So right now we're going to ask Chelsea to get the ice packs on her lips right away. She's going to do those essentially throughout the night, and tomorrow morning she's going to put them right back on. And that'll be it. Over a little bit of time, she'll get a little bit more fullness with the lips as the hyaluronic acid filler takes on a little bit of water. But that's it. This has been an upper and lower lip filler today. Very easy, and we hope you'll come in and see us sometime and have it done as well. All right. Thank you so much, Chelsea.
Thank you, Dr.
Okay.
Gilpin.
Oh, you're very welcome.